Peptides are all the rage. You can use peptides to lose weight and increase satiation so that you're not craving all that food every day of the week. Ozempic, Mounjaro, Zepbound. There's the shame that you've tried everything, and then there's the hope for a silent reset. And peptides may be part of the answer. Hi, I'm Dr. Kathleen O'Neil, also known as Dr. K. I'm here to help you remember what wellness feels like. Peptides are natural groups of small amino acids like a protein, and they exist naturally in the body. And peptides work with our stem cells and with our other body components like hormones, etc., to help us heal. In fact, insulin is a peptide. Growth hormone is a protein because it's bigger than a peptide. If you put many peptides together, you make a protein. So small groups of amino acids are peptides. There are over 7,000 peptides that are available today and that are in the body. And so presently, there's peptides like BPC, Body Protection Complex 157. There's the thymic peptides, TB500, thymosin alpha-1. There's the GLP-1s, Ozempic, Mounjaro, Zepbound. These are all peptides I use every day in my practice. I use them to help heal the immune system. So if someone can't get rid of that nagging Lyme, that nagging long COVID, I use peptides to help them heal so that they can gain back their day, their life, their energy, their function. I use peptides to help heal the mouth. If someone has bone loss in the mouth, if someone has infection in the mouth, we can use peptides in the mouth. I've used peptides to help eye health. At the Kresge Eye Institute in Michigan, they study peptides for keratitis and for neurotrophic problems in the eye, which are basically nerve problems in the eye. So we can use peptides for so many things. Almost every part of the body has a peptide that can be used for it. The other thing that you need to understand about peptides is that they're pleiotropic, they're multimodal. One peptide can do many things. I might use a thymic peptide to boost the immune system, to make more army members, to make more immune cells available, and then I might use another peptide to give the army men in the immune system, in the Department of Defense of our body, bullets or ammunition. You can use peptides to reduce inflammation. You can use peptides to lose weight and increase satiation so that you're not craving all that food every day of the week. They're used in rehab and recovery. It's the rage for athletes to use peptides in rehab and recovery. It's the rage for people to think, at the gym that I'm going to get better. Peptides are used for gut health. If you have a leaky gut, or if you have a Crohn's colitis, or an IBD, or ulcerative colitis, peptides have been shown with ulcerative colitis to be incredibly effective for helping to heal the tissue of the gut. Are they used alone? No, they are used in combination with other treatment modalities, and they are always prescribed by a clinician. The body is designed to adapt to the situation at hand. If you have an infection or if you're gaining weight, the body is adapting to whatever it's experiencing in the world around it, internally and externally. And now peptides can help the body adapt and get a reset. Sometimes in this adaptation process, the body continues to find a cycle and spirals out of control. If the body's spiraling out of control and you're not resolving the issue, whether you can't seem to lose weight, and you need a peptide like a GLP-1 or a GLP-2 for weight loss, or if you're fighting an infection and you can't seem to really get over this infection and it's become long COVID or long haulers or strep that you get over and over again, you may need another kind of peptide like a thymic peptide. Peptides are amazing, they're safe, they're natural, and they're effective. Well, peptides are safe. And our own body makes these peptides. I work with a group of clinicians that have been studying peptides, for example, they're 90 years of age and they've been doing this their whole life, so it's been about 65 years. And even these clinicians have used peptides in children. There was a group of children in Texas at an institution where they used peptides for their immune system health. These children had a particular disease that caused chronic immune deficiency syndrome. And when these peptides were used for these children, long time ago, in the 1960s, these children's immune system improved dramatically and their lives were improved in a significant way. And that's important to understand. Generally speaking, peptides are used for adults. Well, it depends on how sick somebody's been. If somebody's been sick for a very long time, it might take a little bit. But if you never know, because everyone's a unique individual. There are some people in my practice who feel within 3 days better. Are they dramatically better? Are they all better on a peptide after 3 days? No, that's the beginning of the process, and it lets the clinician know that they hit the nail on the nose and that they started with the right type of peptide that the body needed for the particular healing of the injury that that patient had. Peptides can be delivered in a number of ways. They can be delivered oral, they can be delivered subcutaneously, like when a diabetic takes insulin, or they can be delivered through nasal delivery. There are multiple ways that we can take peptide. You're going to take a peptide in a specific manner, mode, depending upon what the problem is. When you take an oral peptide for a GI problem, a gut problem, a leaky barrier, or another problem, then it's going to heal directly that particular source. You can take a peptide injectably just by basically injecting it subcutaneously if you have an injury in your shoulder, in your hip, in your knee. That might be better to take it subcutaneously. If you have a brain challenge, like maybe a focus problem or an ADD problem, you could take a peptide by nasal inhalation. One of the most common peptides that we use is called oxytocin. Oxytocin is studied in medicine, conventionally in mainstream medicine, and has been shown to help with anxiety. You can take oxytocin as a sublingual, you can take it as a nasal spray, you can take it as a subcutaneous injection. There are many ways to treat one problem. And remember, the best way will be what's right for that individual. The important thing to know is, do you need this peptide long term? It's likely that you don't need to take the same peptide forever. It's likely that you might need it for a short period of time. It may be a year, it could be up to 18 months, but generally speaking, I don't get that far ahead of myself. I want to just treat the body in the moment that it's in. I want to understand through labs and diagnostics, have we healed the tissue that we're attempting to heal, and then I can determine how much longer do I need to use this particular peptide, or I'm going to shift to something else. To start a peptide protocol today, find the best clinician that understands, that is licensed to prescribe, and that knows the best sources. There's a lot of fraud and charlatans and counterfeit out there. What you want to do is know the source of the peptide. You don't want to know if it's a powder, whether it's flour or what it is. You want to put something into your body that you know to be true. If you want to learn more, be sure to click the link in this video. For more content to know and remember what wellness feels like, be sure to like and subscribe to this channel.